This is Dr. David W. Kim, and today's video blog is about rhinoplasty and how it relates to the nasal bones. Many times patients come into my office seeking nasal surgery very fearful that I'll have to break their nasal bones. They think this means I'm going to have to break their nose, and in their mind they envision me taking a big hammer and smashing all the bones into several pieces. This could not be further from the truth. In reality, as you can see in this specimen, the nasal bones only occupy the upper portion of the nose or the roof of the nose. It's quite a distance from the bottom of the nostrils, and it's an area that is only relevant to the upper half or bony vault of the nose, as you can see between the eye sockets. In surgery, where we're altering the bottom of the nose, we don't have to touch the nasal bones, and they do not have to be repositioned at all. However, in some patients, like in this gentleman, who suffered a ski injury causing a fracture of the nasal bones, the nasal bones are malpositioned so that the nose becomes crooked. In this individual, I had to use some precise surgical instruments called osteotomes to make cuts in the bone and reposition the nose into a straighter alignment. In other situations, like in this gentleman, he had an overdevelopment of the nasal bones, creating a bump on the bridge of his nose. This type of deformity can happen either from trauma or just from a developmental abnormality over time. He was self-conscious about his profile, so for him during rhinoplasty, I used an osteotome and rasps to lower the height of the nasal bones to create an overall straighter profile. Now, not everybody wants a straight bridge. There are patients who want to preserve a little outward curvature. There are some patients who want a little inward curvature, particularly some women. So we try to tailor our work on the bones to match the needs of the patient. So overall, the risks do not significantly increase just because we're working on the nasal bones. We're truly not smashing or breaking them, we're cutting them and repositioning them into a more favorable alignment. Working on the nasal bones is just one of many maneuvers we use during rhinoplasty to create an outstanding outcome for the patient, both in terms of their appearance and their function. Thank you.